magazine has named Dr. Deborah Persaud one of the 100 most influential persons of 2013. And we are fortunate to have this HIV expert from Johns Hopkins Children's Center here with us at Carib Nation tonight. Stay tuned. Carib Nation is up next. Welcome to Carib Nation. We are fortunate tonight to be joined by Dr. Deborah Persaud from Johns Hopkins Children's Center. Dr. Persaud is a HIV expert focused on HIV in pediatrics, and she has been named by Time magazine as one of the most influential persons of 2013, but I'm sure before 2013 she's been having a lot of influence in people's lives as well because of her work with HIV. As we know, HIV is a significant epidemic that's been affecting our globe. It's also a significant epidemic for the DC, Maryland, and Virginia region where Carib Nation is filmed, but as well in the Caribbean. So tonight, we're so grateful to have you join us. So Deborah, can you tell me a little bit about why you were named as one of the most influential persons of 2013? Mm-hmm.
Well, I think what this represents is really the need to find a different approach for HIV/AIDS.
Mm-hmm.
I think it represents the drive to find a way to cure, and I pause in using the word cure because I think it's important to define what we mean by curing HIV-infected child, say, for example.
What may be a monumental advance in fighting AIDS.
Doctors in Mississippi and Boston discovered a baby born with HIV was cured almost by accident.
The discovery was made at this Jackson, Mississippi Medical Center, where the HIV-infected mother and her baby were treated.
We have, perhaps inadvertently, but in fact, cured the child.
But the case is a bit of a puzzle. After birth, the child was given 3 different medications to aggressively fight the virus. At some point, doctors lost track of the mother. 1 year later, they discovered she had stopped giving her child the medications.
After the baby had missed several appointments, we started looking for her.
They eventually found the mother and her baby, and then the clinic ran tests to see how much HIV was still in the baby's blood. Doctors found no trace of the virus.
My first thought was to panic. I thought, oh my goodness, I have been treating a child who's not actually infected.
But after lab work was checked and double-checked, doctors from Boston and Baltimore were brought in to begin research.
I think we were both incredibly surprised.
So now, at 2.5 years old, doctors say the child no longer requires any medications.
So in the case that we described, the Mississippi child, this was a baby who was known to be HIV infected, who received the antiretroviral treatment very early, meaning within the first few days of life, and was able to go off antiretroviral treatment after 18 months of therapy. Now we know from all of the work we've done and in studying HIV treatment in children that this usually never happens.
Right.
And that is a person is not able to go off antiretroviral treatment and maintain control of the virus to the point that there's no active infection still present.
Right.
So this is really a turning point, or what I call it, the tipping point in HIV treatment, where we have a glimmer of hope, at least for pediatrics and children, that perhaps starting therapy very early could change the face of treatment with a goal towards cure, or what we're really calling this case a case of sustained viral remission.
Okay.
And so it's a single case, but it really provides hope. And I think it's that hope that really allowed us to gain recognition. Myself and the 2 colleagues, Dr. Hannah Gay, who was the pediatrician who managed the child, and Dr. Catherine Azuriaga, an immunologist who studied early treatment in children for decades. And so I think it's that finding that put us in the spotlight towards recognition for Time 100 magazine. And while it's recognition for us, to me it represents recognition for the field of pediatric AIDS and the progress that has been made in the past 20 years.
Yeah. Can you tell me a little bit about some of those milestones of progress that we've achieved over the last 20 years?
Yeah, it's actually being at this place and time has really allowed me to reflect on the epidemic over time. And I was fortunate to be a medical student in New York City when the epidemic broke in the 1980s. So saw the devastation of pediatric AIDS in mothers and infants. But then have lived through the progress in prevention of mother-to-child transmission. And as you may know, in the years that I was training in the 80s, 30% of women transmitted the virus to their babies. Now, with prevention and treatment, less than 2% of women transmit the virus to their infants. So I do want to point out that it's very important for women, pregnant women, to be tested and receive treatment, and so that their babies can also get prophylaxis to prevent transmission of the virus. But for the unfortunate few in whom the prophylaxis doesn't work, perhaps we will get in the next 10 or 15 years to the point where we can talk about curing HIV infection, not just in one infant, but most of the infants who acquire infection through failure of prophylaxis.
Yeah. So, and I worked with a number of women who did transmit HIV to some of their children way back in the 80s. And then now working with women as well who are living with HIV, I've definitely seen exactly what you're talking about. There's been such a reduction because there's so many advances as it relates to medication for HIV and antiretroviral treatments. But what does this functional cure in this one individual mean for mothers, women who might be living with HIV, who are interested in pregnancy, but who are concerned about the possibility of transmitting to their infant?
Yes, I do want to emphasize that we know how to prevent a mother from transmitting infection to her baby. And that's the key point of all this, is try to prevent infection, and we have measures to do that. But some women don't know that they're HIV infected. They're not identified until late in pregnancy or at the time of delivery, as in the Mississippi child. And so at that point, it may be too late to prevent infection fully or reach the level of less than 2% transmission rates. And so in those situations, we would hope to have new treatments to be able to say that we can cure or achieve remission in more than one child. I will say, the whole field of HIV cure research is a moving target. It's an exciting time for HIV therapeutics. For adults and children. And this single case in a child has really been a catalyst for research and investment towards cure research in HIV. So we're a far away from curing HIV, but I think when we look back into where we were in terms of treatment and only had one drug to treat infection, such as AZT, and now we have over 25 drugs to treat infection. We know how to treat infection. In fact, our perinatally infected kids, or kids infected through mother-to-child transmission, are in their late 20s to 30s. And so we will get to a point where our children are growing into adults, and these cure strategies or ways to cure HIV that are being studied for adults will also have application for our children as they age up into adulthood.
Yeah. And you talked a little bit about this, but so what does this research that you've done to identify this remission in this baby mean for adults? Like, is there more research being done related to remission for adults right now?
So there are many studies being done looking towards how to put the virus in a state of remission in an infected adult. With respect to very early treatment, we now have clues in HIV-infected adults from small numbers of patients, 15 or 20 patients, showing that if you treat early, we may be able to change the need for lifelong treatment. And those are exciting clues. And again, they remain clues, as in the Mississippi baby, but we're hoping with each of these pieces of the puzzle that we can come up with a larger understanding of how to achieve cure through very early treatment, not only for children, but for adults. Obviously, the difference between pediatric infection and adult infection is we know when babies are exposed to the virus, whereas most adults don't know when they acquired infection. And so that window of opportunity to treat early may not be so apparent for an adult as it is for an infected infant.
Talking about early identification, and I know my Caribbean people, and often, you know, what some of the data is showing is that Caribbean people tend to show up, especially here in the US, late for testing. So we show up at the point when we may already be very close to an AIDS diagnosis in the emergency room, or when we feel very sick. So I'm interested in, you know, what would be your message for Caribbean people related to testing, related to identifying HIV in their systems?
So it's, you know, it's obviously a very scary diagnosis. It's just knowing you're HIV infected, but I think it's important to point out that we know how to treat HIV infection and how to prolong lives. I think the measures now that are, you know, public health policies with respect to testing all persons presenting to emergency room for care 13 years of age and older through age 65, I think is one great way to be able to identify individuals early as part of routine care. People need to be educated in terms of the importance of early testing and linkage to care. I think with the community services that you're involved in and that are, you know, our state governments are involved in, hopefully it will affect change with respect to attitudes towards testing for HIV. We still deal with stigma and HIV, and unless we break down the barriers towards stigma with HIV, I think having people come forward towards testing is going to be challenging. I mean, even in Africa, where, you know, much has been done with respect to testing and engagement in care, perhaps more than has been done here within the US, the stigma that persists or prevails, it is what really prevents the public health policies from being implemented. But at the flip side, I think the optimism towards the words cure, and while it may be false optimism in a way, I think it engages people to think about HIV testing, care, and treatment, and hopefully towards a pathway of cure eventually.
And you talked a little bit about PrEP, but can you tell us a little bit more about what PrEP is?
So PrEP is pre-exposure prophylaxis, and so it's an expensive drug regimen that's used to prevent infection in high-risk populations, such as men who have sex with men, as a way to curtail or to minimize the risk of acquiring HIV. Given that we have no vaccine available to prevent infection, it certainly is a good option to protect individuals from acquiring infection.
Yeah, so there's a possibility that you can take medication prior and potentially prevent HIV infection with this pre-exposure prophylaxis.
That's correct. So that by having medications on board, it prevents the virus from entering into the cells that it likes to infect and stay within, and that allows the virus to persist for your lifetime. So the medications on board prevent the virus from entering into what's called a productive state of infection or a replicative state of infection.
So, I mean, we're talking a lot of science right now, but you are such an inspiration to me and to so many young people who see you as having worked to get this wonderful accomplishment, being someone from the Caribbean. What do you tell a young person, you know, to encourage them to stay the course and to stick to their goals to achieve such an accomplishment as you've had.
So I never expected to be in this position. I wouldn't give my age this many years later, but I actually was interested in medicine as a very young child. In Guyana, when I was about 10 years of age, I was hospitalized and for a while, several weeks on an open ward, and medicine had an impact on me. It had an impact on my life. And so when I came to this country, my goal for myself was to become a physician. And that idea was actually fostered by my mother, who was a single mom with 4 children, who emigrated to this country as an immigrant and as an illegal immigrant. But you know, for her, education was very important for her children because she herself was not educated. And so bit by bit and step by step, I've been able to stay focused with a goal in mind, with support. I mean, I think it's really support of many individuals that reassure you along the way that you're doing good work and supporting you to get to the next step. This is not something I've accomplished on my own. By no means. There are many individuals who are involved in where I am sitting today. And where I'm sitting today is really to be able to contribute to the field of HIV/AIDS now and for the future. So for the young people, I would say education really is the key, and staying focused is the key, and being disciplined is the key, and it will pay off, not really for me personally, but for the goal of the research and the illness that we're working on.
And for that young medical student who is, you know, pulling his hair out because school or classes are really difficult and there's a lot of competition in school, what do you tell him about sticking the course? Or
so medicine is unique in that, you know, it's very hard, and there's a lot of you know, studying and direct, you know, you're always with your books or internet access or whatever. But the critical part of medicine is, part of the training is you engage in people's lives. And it's that interaction with human life and seeing outcomes, death and life, that gives you that energy and drive to continue along the path. I mean, it's not an abstraction, it's interaction with human lives. And for me, that's been the major part of being a physician and being a physician scientist in this game, is that there's nothing like the face of a family or the outcome of an illness on a family that gives you that drive to either improve things or a sense of satisfaction that you've made a change in a positive direction. And so I continue to care for patients, not just patients with HIV/AIDS, but infectious diseases at Johns Hopkins Children's Center. And in fact, I was just on service, and is why this is interview so delayed. And the impact of human life and human interaction is a powerful interaction. And each day I do clinical rounds and interact with young physicians, medical students. You realize that we are in such a unique position as a professional to impact on human lives that I really can't describe that feeling on a day-to-day basis.
Yeah, but you just gave me goosebumps describing your passion for this work and for people as you do this work is amazing. But so you're receiving an award for the Caribbean American Heritage Award. So tell me about your thoughts on this recognition from the Caribbean American.
So it's actually thrilling to be recognized by the Caribbean, as you know, to receive the Caribbean Heritage Award, because you're from the Caribbean, you know, you're always from the Caribbean. And I've spent most of my life here, not in the Caribbean, but the sense of family, community, service, and sense of self that you get from growing up in the Caribbean is indescribable, I think. As you know, it's a simple way of living. You know, life here is very complex. It's simple, but it's rich. It's rich in culture, music, food, And it's so embedded in you. I mean, I've spent the first 16 years of my life in Guyana, and I've still, my family's in, my mother's in Brooklyn, you know, Brooklyn is the Caribbean hub. And so in visiting my mother on a regular basis, and it's unfortunate my mom is not mentally with it to be able to witness this, because I think she would, this is really for her. She would be thrilled to see me sitting here representing the Caribbean, and the Caribbean for a benchmark in medicine that was unexpected through, as you know, in my journey here in transitioning from the Caribbean to the United States. And so it really is indeed thrilling for me. Also for my kids. You know, I think the word Caribbean American defines my kids. My husband's American and I'm Caribbean, and we're never sure which box they should check off. There's no box that really fit my kids other than other. And I think Caribbean American really describes my family right now. They share both cultures, the Caribbean culture and American culture, because my family still lives in Brooklyn. We visit them very regularly.
Which is Little Caribbean.
It's Little Caribbean. So it is a thrill for me to be able to receive this recognition, but not only the recognition, but to represent a role model for other Caribbean kids who moved to America for the American dream. I really believe I represent the American dream, from where I started to where I am today. Definitely.
And so Time Magazine calls up and says, we want to have you as one of our 100 most influential people. What went through your mind?
So actually they didn't call, they sent an email.
Oh, they sent it.
And I thought it was spam. So I deleted the email until our PR office said, you need to respond. Are you going to attend this event or not? So I actually didn't believe it, that we were selected as Time 100. It was a beautiful event in New York City with a diverse set of individuals from people in sports, medicine, music, arts, comedy, and so it was quite an accomplishment to be amongst such a diverse group of really service people when you think about it. I mean, we all serve our community and this country. And for me, that's what it represented.
Wow. Our show is aired across the Caribbean as well as for Caribbean audiences in different international countries. And, you know, I think this is a great vehicle for us to share that message of prevention as well as just knowledge of access to treatment for people who are living with HIV. So I'd love for you to take a moment to share, you know, for someone who's watching, what should be a message that they take away about HIV and about HIV treatment or prevention for themselves and their families?
So first I would start with HIV treatment. So in other words, for the individual who's infected, we've made major progress in prolonging life. We've made major progress in prevention. And by taking care of yourself and receiving treatment, you preserve your life, you preserve others' lives by not transmitting infection. And for women, this is critical because children are so dependent on their mothers for survival that by getting treatment for yourself, you actually save the family structure, the economic structure of a society. And so I think that's the first message I would give. For those who are infected, it's important to seek treatment and to stay on treatment because it is life-saving. We've seen that, it prolongs lives. And I think that's the greatest outcome of the PEPFAR program is really to be able to show, even in sub-Saharan Africa, with very limited resources, that we could, distribute complex antiretroviral treatment with the metric of saving lives. And then the second has to do with prevention. Prevention is key. We have no vaccine for HIV. And so we know how to prevent HIV. Simple use of condoms. PrEP is, yes, PrEP is part of prevention, but it's expensive and it comes with toxicity. And so it's important to use simple prevention measures. And then mother-to-child transmission. Really, in the United States, there are about 150 infants who are still infected, despite our routine screening of pregnant women, and that's 150 too many. We should really not have any HIV-infected infants in this country. And worldwide, even though we know how to prevent infection, we still had 260,000 infections last year in infants. And so prevention is key to really be able to curtail the epidemic. Bodies like the UNAIDS with missions for elimination of pediatric AIDS infection really set the bar towards prevention. And again, I hope the lessons we learned from prevention in mother-to-child transmission will translate to prevention amongst adults and will really curtail the epidemic.
Well, you know, Dr. Persaud, your research has definitely made some inroads in creating more hope for our community as it relates to a potential cure or potentially future further identification of remissions in more people living with HIV. You are truly an inspiration for us, and as a Caribbean woman, you know, we look up to you for the work that you've done and for the work that you're going to continue doing. Your passion is just unbelievable for how you work with people, and the way that you spoke about your passion for medicine is phenomenal.
Well, thank you.
Do you have any last things that you want to share with us, or anything that you want to tell us about your work right now?
Well, I do want to emphasize the point about prevention again. You know, I think cure is a great goal, but it's a far-reaching goal right now. We don't want to give false hopes to the community, but we do want to give optimism that there is a movement, an energetic movement towards cure. And without that sort of movement and energy, I think we would really not have, our future in terms of how to manage this disease going forward would not be as momentous as it is right now. And I think we need charges like these to not be status quo.
Well, we just heard it. There's a movement. We need this momentum. Dr. Persaud's identification of this functional cure can serve as further momentum for us as we deal with HIV and as we address this epidemic internationally. You know, Dr. Persaud, thank you so much for taking this time to share, you know, your work and to share your success with us this evening. We are Carib Nation. We are one people, one culture, one Caribbean, one nation. Thank you so much for joining us.